Stanley and this is Emeka, our part of Mother Care Initiative, and today we're going to be talking to you guys about baby blues, also called postpartum blues. So I'm going to start by telling you guys exactly what baby blues is. Baby blues is a very common medical condition that's experienced by new mothers. It gives them these mood symptoms. Some of the symptoms include mood swings and irritability. So we're going to talk more about the symptoms later in the video. So we're going to talk about the causes now. There are no concrete accepted causes for baby blues, but there are hypotheses floating around. This is what people think cause baby blues, and some of those causes are psychosocial. It's divided into psychosocial causes and biological causes. So Emeka is going to talk to us about the psychosocial causes, and then I'll talk about the biological causes. So go ahead.
Yeah, the psychosocial causes can be, fatigue during labor or delivery, financial stress, strain in marital or relationships, and also sleep deprivation and lack of support from family and friends can all contribute to this.
So I'm going to talk about the biological causes. The biological causes, they basically revolve around these two hormones, estrogen and progesterone. So these two hormones, once a lady gets pregnant, they start rising, and as soon as she has the baby, they crash, and that crash in estrogen and progesterone combined with the psychosocial factors, they come together and they are what is generally believed to cause baby blues. So now we're going to talk more about the symptoms I mentioned earlier. So some of the symptoms include irritability. She gets upset over things that normally wouldn't upset her. Then she has mood swings. One minute she's happy, next minute she's tearful and sad over the baby. She has problems with her appetite. She's not eating as well as she used to. Then she has problems with sleep. She's not getting to sleep. She's not able to sleep properly, or when she sleeps for a while, she starts waking up in the middle. And then she also starts doubting herself whether she's able to take care of the baby properly. And those are some of the symptoms you can find with baby blues. So now I'm going to talk about how to prevent baby blues. I mentioned the causes earlier on. So because the causes are not established, the preventive measures are also not established. But based on what we know, most medical associations of obstetrics and gynecology, they recommend screening pregnant women for depression. So what screening does is that it helps us identify pregnant women who are at risk of developing depression. So based on that, we kind of know to educate them. We know to tell them that, okay, these symptoms are possible, and it's possible that you might get these symptoms once you deliver. So don't be scared, don't be anxious about these symptoms. It helps ease them. And we also try to make sure that they have good support systems in place, like social support from the family, friends, from the spouse, and they're able to ask for help when they need it. So these are really good and effective preventive measures that have been put into place, but they're not widespread, they're not widely known. So now Emeka is going to talk to us about the diagnosis of baby blues.
So for the diagnosis, there's actually no standardized criteria for diagnosing postpartum blues. Actually a very mild condition compared to postpartum depression or postpartum psychosis. Is the mildest among those conditions. So the risk factor has consistently shown to be predictive includes a history of personal depression or family history of depression. So Stanley will talk to us about the treatment.
So about the treatment of baby blues. Baby blues is a self-limiting condition. Self-limiting means that it will resolve on its own without any medical intervention. So what happens is that baby blues usually resolves usually within the first 3 to 4 days after delivery, peaks at around 5 days or 6 days, and then it usually resolves itself before 2 weeks. So if it goes past 2 weeks, then it's more likely to be something more serious, a more serious postpartum psychiatric condition like postpartum depression or postpartum anxiety or any of the more serious ones. But generally, baby blues on its own is a self-limiting condition, doesn't require any treatment. But that being said, certain support systems need to be in place. She needs to have access to good food so that she eats properly. She needs to have sleep because sleep affects mood. All these things affect mood. She needs to have a good support system like family, friends, spouse to help her. She needs to be able to ask for help. So all these are really good for easing the symptoms of baby blues. So now Emeka is going to talk to us about the prognosis of baby blues finally.
So the prognosis is actually excellent. Like Stanley said, if your mother has the postpartum blues, it will resolve before 2 weeks. If you persist to see your doctor, and then you might be postpartum depression, you need to get evaluated, So I really hope this video was really informative for you guys. I'm Emeka and Stanley from Mother Care Initiative. You guys should like the video and support us by subscribing to the YouTube channel. Alright, thank you. Bye.
Bye guys.